So our next presenter is Dr. Chi-Fu Yang, who will present both early diagnosis of lung cancer among younger versus older adults, widening disparity in the era of lung cancer screening, and incidence, timing, and survival of second primary lung cancers in patients in the National Lung Screening Trial, the NLST.
Great, thank you very much for the opportunity to share our work with you today. And I'd like to thank the ISLC World Conference on Lung Cancer and the members of the press for their time, and also acknowledge the work of our first author, Alexandra Potter, who is here also in the audience. We have no disclosures related to this presentation. With the onset of lung cancer screening in the United States, the number of patients diagnosed with early stage lung cancer is increasing. Many patients with screen-detected lung cancers achieve excellent long-term survival, raising the importance of examining the risk of developing second primary lung cancer in this population. The risks of second primary lung cancer among lung cancer survivors has been shown to be 4 to 6-fold greater compared to the risk of lung cancer in the general population after adjusting for age, sex, race, and calendar year. The objective of this study was to examine the incidence, timing, and survival of second primary lung cancers using data from the National Lung Screening Trial. We queried data from the National Lung Screening Trial, which is a large-scale randomized trial that compared the effectiveness of low-dose computed tomography versus chest X-ray in reducing lung cancer mortality. The NLST enrolled 53,454 high-risk individuals aged 55 to 74 who currently smoked or quit smoking within the past 15 years. For the present study, we included patients diagnosed with clinical stage 1 to 3 initial primary lung cancer in the National Lung Screening Trial. Second primaries were categorized as either synchronous or metachronous. Synchronous primary lung cancers were defined as second primary lung cancers that were diagnosed within 6 months of the first primary lung cancer. Metachronous primary lung cancers were defined as second primary lung cancers that were diagnosed more than 6 months after the diagnosis date of the first primary lung cancer. We examined the incidence and timing of second primary lung cancer among patients in the study cohort. In addition, overall survival of patients with synchronous and metachronous lung cancers was examined using the Kaplan-Meier method. Of the 1,971 patients diagnosed with lung cancer in the NLST, 1,405 patients were diagnosed with clinical stage 1 to 3 initial primary lung cancer. The incidence of second primary lung cancer was 5.8%, of which 55% were synchronous and 45% were metachronous second primaries. This table shows the baseline characteristics of patients in the study cohort diagnosed with synchronous and metachronous primary lung cancers. The median follow-up time of patients diagnosed with synchronous primaries was 29.8 months. The median follow-up time of patients diagnosed with metachronous primaries was 65.9 months. The median time from first to second primary lung cancer was 32 months for patients diagnosed with metachronous second primary lung cancer. There were no significant differences with regard to age at diagnosis of the first primary lung cancer, sex, or pack year smoking history between patients diagnosed with synchronous and metachronous second primary lung cancers. These pie charts show the smoking status of individuals diagnosed with synchronous and metachronous second primary lung cancers. 71% of patients diagnosed with synchronous primaries and 68% of patients diagnosed with metachronous second primaries currently smoked at the time of randomization. These graphs show the types of treatments received for initial primary lung cancers among individuals who had a synchronous or metachronous second primary lung cancer. Most patients who developed a synchronous or metachronous lung cancer in the study cohort underwent surgery for their initial primary lung cancer. Of patients diagnosed with synchronous primary lung cancers who underwent surgery for their initial lung cancer, 62% underwent lobectomy, 29% underwent wedge resection. Of patients diagnosed with metachronous primary lung cancers who underwent surgery for their initial lung cancer, 79% underwent lobectomy, 12% underwent segmentectomy, and 6% underwent wedge resection. Next, we assessed changes in the incidence of metachronous primary lung cancer from the date of initial primary lung cancer diagnosis. Among patients with stage 1 lung cancer, the incidence rate of metachronous primary lung cancer increased with increasing time from the date of first primary lung cancer. Similar trends were observed among patients diagnosed with stage 2 to 3 second primary lung cancer. However, no second primaries were diagnosed more than 5 years after the date of first primary lung cancer diagnosis among patients with stage 2 to 3 first primary lung cancer. These pie charts show the stage distribution of the initial primary lung cancer among individuals diagnosed with synchronous and metachronous second primary lung cancers. Among patients who developed synchronous second primary lung cancers, 65% had stage 1 initial primary lung cancer. Among patients who developed metachronous second primary lung cancers, 81% had stage 1 initial primary lung cancer. This diagram shows the stage distribution of second primary lung cancers diagnosed among patients who had stage 1 initial primary lung cancer. Among patients with stage 1 initial primary lung cancer who developed a second primary, the stage distribution of second primaries was 83% for stage 1, 7% for stage 2, 5% for stage 3, and 5% for stage 4. Among patients with stage 2 initial primary lung cancer who developed a second primary, the stage distribution of second primaries was 43% for stage 1, 29% for stage 2, and 28% for stage 3. And among patients with stage 3 initial primary lung cancer who developed a second primary, the stage distribution of second primaries was 73% for stage 1, 20% for stage 2, and 7% for stage 3. We also examined the stage distribution of second primary lung cancer stratified by the number of months after the date of initial primary lung cancer diagnosis. Over 80% of second primary lung cancers that were diagnosed within the first 2 years of initial lung cancer were stage 1. Second primary lung cancers diagnosed more than 4 years after the date of initial primary lung cancer diagnosis were more likely to be identified at later stages. This diagram shows the distribution of the histologic subtypes of second primary lung cancers among patients diagnosed with initial primary lung cancer that was adenocarcinoma histology. Among patients diagnosed with adenocarcinoma initial primary lung cancer who developed a second primary lung cancer, 67% of second primaries were adenocarcinoma, 13% were squamous cell, 10% were lipidic adenocarcinoma, and 10% were other histologic subtypes. Among patients diagnosed with squamous cell initial primary lung cancer who developed a second primary lung cancer, 23% of second primaries were adenocarcinoma, 36% were squamous cell, 9% were lipidic, 14% were small cell, and 18% were other histologic subtypes. This figure shows the overall survival of patients diagnosed with stage 1 synchronous or metachronous lung cancer during the study period. In this figure, the x-axis is the time in months from the date of initial primary lung cancer diagnosis to death from any cause. 5-year overall survival was 55% for patients diagnosed with synchronous primary lung cancers and 90% for patients diagnosed with metachronous primary lung cancers. 10-year overall survival was 39.5% for patients diagnosed with synchronous primary lung cancers and 30.8% for patients diagnosed with metachronous primary lung cancers. We then examined overall survival from the date of second primary lung cancer diagnosis. Notably, overall survival from the date of second primary lung cancer diagnosis was similar for patients diagnosed with synchronous and metachronous second primary lung cancers. For patients diagnosed with synchronous second primary lung cancers, survival is similar to that presented in the previous slide. For patients diagnosed with metachronous second primary lung cancers, 5-year overall survival was 51.8% and 10-year overall survival was 22%. We also evaluated the causes of death among patients diagnosed with stage 1 initial primary lung cancer who developed a synchronous or metachronous second primary lung cancer. The large majority of patients who developed synchronous or metachronous second primary lung cancers died from lung cancer. There are several limitations to this study. First, the findings may not reflect the risk of second primary lung cancer in populations outside of the NLST eligibility criteria. Second, over 90% of participants in the NLST are white, and these findings may not be generalizable to patients of different racial groups. In addition, the NLST does not include detailed molecular data for patients diagnosed with 2 primaries of the same histologic subtype. Lastly, the NLST does not include complete data on the mode of treatment of second primary lung cancers. In conclusion, among patients diagnosed with lung cancer in the NLST, 6% of patients developed a second primary lung cancer, which is a rate of 1 to 2% per patient year. The median time to diagnosis of metachronous primary lung cancers was 2.7 years. 27% of second primaries were diagnosed greater than 4 years after the date of first primary lung cancer diagnosis, illustrating the importance of lifelong follow-up. 5 and 10-year overall survival from the date of initial primary lung cancer diagnosis of patients with synchronous primary cancer was 55.2% and 39.5% respectively. 5 and 10-year overall survival from the date of initial primary lung cancer diagnosis of patients with metachronous primary cancer was 90% and 38.8% respectively. Thank you.